And I'll just give you a quick tutorial about WebEx. I think we are all pretty familiar, but just so that we're on the same page, you can turn on closed captioning if you like by hitting the button, the CC button at the bottom left-hand corner of your screen. You can also change how your layout looks or what you're seeing looks by clicking the layout button at the top right-hand corner of your screen. If you want to ask a question or you have something to say, you can just raise your hand using those icons at the bottom of your screen. Or if you want to react to something, there's a reaction button there. You can't unmute yourself. So in this webinar format, so if you have a question that you'd prefer to speak out loud, just raise your hand and I can unmute you if you wish. And as we've gone over, the chat is there at the bottom right-hand corner of your screen. So you can also use that to pose a question, or if you have a comment or any trouble during the session. So I'm going to stop sharing, and I will turn it over now to Cheryl. Thanks, Cheryl.
Thanks, Chelsea. Well, maybe I will. Hi, everybody. Thanks for being here today. I don't know if I have extensive expertise in the area of policy, but I have worked in it in some capacity for the last about 20 years now, I would say, maybe even a little bit more. So I would like to share some of that with you today, because I think that it can help. Having a knowledge of how policy development and policy change works can be helpful if you're trying to communicate your research ideas or findings with decision makers. So I will go ahead now and share my screen, and I'm just going to stop my video for this. Chelsea, can you see my my slides?
Sorry, I was muted. It looks great, Cheryl.
Okay, great. I couldn't hear you for a second. I thought, oh no, the tech. Okay, awesome. So like I said, I'm going to share some things with you around policy that I've learned over the last number of years. And I know the processes may not be exactly the same depending on where you are, depending on where you live and what your background is. But most of the things that I'll talk through around the considerations when you're writing discussion papers or policy documents, they're going to be relevant, I think, no matter where you are. So I worked in, after finishing my master's degree, I worked for several years, for a couple of years, in health services research at the Ottawa Health Research Institute. And from there, I moved back to Newfoundland and Labrador, and I worked in a policy position with the government of Newfoundland and Labrador for about 4 years, 4.5 years. I was a program and policy development specialist, which is basically a policy advisor kind of a role. And in that role, I wrote various policy documents like briefing notes and cabinet papers. And that gave me a good understanding of policy and certainly the amount of work that goes into developing policy and the kinds of things that can influence it. After that, also with the government of Newfoundland and Labrador, I moved into a managerial position with Executive Council, and I was in that role for about 6 years. And there I gained a better understanding of how data can be used to change policy within government. Now, for the last 7 years or so, I've been working as a health policy analyst with Quality of Care NL at Memorial University. And we're a research and evaluation program that's ultimately aimed at improving health and social outcomes in the province. Most recently, in that role, I served as Secretariat support for the Community Care Committee on Health Accord NL, and that was the premier of our province's task force on improving health in the province. That's probably the most significant policy work that I've been involved in with big policy implications in the province. And I'm currently working on a project that's related to the implementation of family care teams in the province. And that was one of the calls to action that came out of the task force final report. So I'll say again, I don't consider myself an expert in policy as such, but I do have a good understanding of how the policy development process works. and how much of what's involved in that can be really helpful for a health researcher who's done some really good work and wants to communicate that with decision makers. Okay. Oh. So what do we mean by policy? The simplest way to think about it is as a plan or course of action. So there may be some sort of problem that's been identified or some issues come to light, and a policy is oriented toward the solution to that problem. So we can think about policy development then as the process of taking an idea about how to address a problem and transforming it into an action. Government policies contain the reasons that things are to be done in a certain way and why. So in health, what are some examples then of policy? Well, in my province, in Newfoundland and Labrador, our MCP, or our medical care program, that covers the cost of physician services for people in the province. All provinces have the same type of program. When your government announces that it's going to build a new hospital, that's a policy decision. Right now, we've entered flu season. When your government announced that the flu shot would be publicly funded, as it is in most provinces, that was a policy decision. Same thing with publicly funded COVID vaccines. Those are all policy decisions. Now, government commits publicly to policy decisions with their framework documents and strategic planning documents. In Newfoundland, currently, the Liberal Party's platform document is rising to the challenge, I believe it's called. That's our government's policy document. It's a document that outlines the long-term vision for our province and then sets the policy direction that's going to get us there. Now, the best example I can give from my own recent experience with policy documents is the Health Accord NL's final report that was released last year with recommended actions to significantly improve the health of the province over the next 10 years. Now, one of those calls to action involved the creation of community care teams for primary health care, and those are now called family care teams, and that every resident be connected to one of those teams. So the delivery of primary health care and family care teams is one of our policy directions now that we're seeing it now, and that came from recommended actions in that report. Another recent policy direction of our government is around well-being. So trying to increase and build awareness and action to influence the social factors on health outcomes and quality of life. So as such, well-being networks are being created in the province. Now, how are these public policies made and changed? And can your research influence that at all? Policy can be influenced from a number of sources, coming from both inside and outside of government. So within government, ideas may come from deputy ministers and assistant deputy ministers. There may be changes in government structure, like a department may lose a branch or some departments may join that could impact and influence policy. For financial reasons, analysis of expenditure and revenue trends could result in policy change. And then evaluation of existing policies, policy reviews, those sorts of things can impact policy decisions and policy. So for example, in other provinces in Canada, at various points in time in the early 2000s, governments created third-party entities called health quality councils to help address health quality issues and health system performance issues in their provinces. Those were big policy decisions. Outside of government, the public influences a policy through their concerns. They may send letters, emails, there might be media coverage. In Quebec, actually, they don't have a health quality council per se. They have the Office of the Health and Welfare Commissioner that was established in early 2000s, and it was abolished in 2016 because that was a policy decision that was made in 2016 by their government. But because of public influence, largely, it was reestablished in 2019 as it forms almost like an auditor general function of their health system, reporting on health system performance. Another way influences may come from outside of government. Researchers, like some of yourselves, may approach government and decision makers with evidence that challenges current policy. There may be lobbying from different interest groups. I know several years ago in our province, groups started calling for our government to legislate mandatory staffing in some long-term care homes for seniors because of safety and care concerns. Technological advances can influence policy. Legal judgments from courts can influence policy. Many external factors can come into play that may influence policy and government. And government itself sometimes, depending on the priorities and backgrounds of leadership within government, that can influence policy. In Newfoundland and Labrador, for example, our premier's background is in health. And so he may have a very keen interest and focus on health-related policies. And then often there's overlap in that one influence, more than one influence may be acting at the same time to influence policy. But always present is the election platform and political will. So how do policies develop and change? Well, often policy changes require a decision of cabinet. And that's the executive branch of government that's made up of ministers. So a policy proposal is written and as a cabinet submission. And that's where a policy professional demonstrates their analysis of the policy issue and seeks approval for some recommended direction. That document's laid out in about 5 pages and in a very specific format and follows a timeline. The document itself and all the drafts are confidential, but cabinet approval is not always required to change policy. So for direction on existing policies and programs, a briefing note could be sufficient for approval by the premier or a minister or another executive member. A briefing note, that's a shorter document. It's a short document about 1 to 2 pages that will specify the decision or direction that's required. It gives a little bit of a background and the current status of whatever the issue may be, and an analysis of the recommended directions and alternatives for consideration. Now, a general rule of thumb is to look at whether or not the policy change falls under the minister's authority. So there's no new funding required, no legislative changes, there's no increased burden on stakeholders. So you look to relevant legislation. If it does fall under the minister's authority, then cabinet approval would not be necessary. But if it falls under the legislative authority of the lieutenant governor, cabinet approval would be required. So think about any decisions that involve new funding or funding that needs to be spread across multiple fiscal years, any amendments to legislative acts or regulations, making board appointments, proposals with other major policy implications. But in lean financial times, like we are and have been for a while in our province, more decisions are being sent to cabinet for approval. Now, this may be relevant to you because from a health services research perspective, it's helpful to know that some change requires a timely cabinet process. And I think there's value in knowing that whether cabinet approval is required or not, research and analysis is required for ministerial or other executive approval of policy direction. So I'm going to talk about the policy process or the policy cycle and all of the things that need to be thought through when developing a cabinet submission. So understanding this process and the things to consider throughout that process, they can help frame your own policy documents when you're thinking about how to communicate your research to decision makers. And let's say your research can lead to policy change. Like if that change requires cabinet approval, then all of the things in this cycle will have to be thought through. So you might as well do as much as you can up front. Now the image on this slide that was modified slightly from Policy NL's website, which is actually no longer active, but the utility of this cycle remains, of this image remains. Policy development moves through these 6 stages. From issue identification and definition to policy research and analysis, to generating solutions and alternatives, to developing the proposal, the cabinet submission, to implementing and then evaluating. Now, running through that entire cycle, You'll have consultations with key stakeholders and a number of things to consider as you work through policy development. Now, I'll note that not all these stages are mutually exclusive, but the policy cycle provides a really good framework to discuss the process. So let's do this by walking through a hypothetical situation. So for the next little bit, you're going to be a policy professional in the Department of Health and Community Services with the government of Newfoundland and Labrador. So what's the problem? What's the issue? First, we want to be sure that the problem is clearly defined to be sure that we're indeed targeting the right problem and therefore not misallocating resources. So in Newfoundland and Labrador, a local research group approaches your deputy minister with data from reputable sources that reveals many people in the province are living in poverty. Now, poverty is a social determinant of health and linked to poor well-being and adverse health outcomes. So the Department of Health and Community Services is exploring developing a new policy on poverty. So what's the desired health outcome here? What's the desired outcome here? What does the policy hope to achieve? Well, the goal is to reduce poverty, improve income security, and boost well-being. Long term, the goal would be improved health outcomes like decrease in chronic disease, for example. Now, this policy area aligns very well with the main tenet of Health Accord NL, that we can improve health and health outcomes by accepting and intervening in social determinants of health, and the specific recommended action that in that final report, that we ensure that Newfoundlanders and Labradorians have a livable and predictable basic income to support their health and well-being, integrated with provincial programming to improve food security and housing security. So we've defined our problem. Next, we move on to policy research and analysis. This is where policy professionals, like yourselves right now, work to understand the problem and develop solutions. Think about context. What is the current state? What you're going to notice is that part of this process is asking a lot of questions. So in Newfoundland, who's currently receiving basic income support? How old are they? Is it mostly seniors, single individuals, families with young children, persons with disabilities? Is this problem province-wide, or is it only in some areas? Is there something different about areas where poverty is higher? Where are they located? On the island or in Labrador, or both? In rural or urban Newfoundland? What types of support are being accessed? Is it income only? Or is it also housing, food, health benefits, transportation, social workers? How much and what amount of income support are they receiving? Can increasing basic income enhance participation in the labor market? What proportion of the population does not receive income support but is living below the poverty line? What is the cost of living currently in Newfoundland? What does that calculation include? Food, clothing, shelter, healthcare, things to improve financial health, social health, emotional health. Who are the stakeholders? In our example, they may be the public, current income support recipients, special interest groups, for example, the Association for New Canadians, perhaps Indigenous groups, Single Parents Association, food banks, Newfoundland and Labrador Housing, the Department of the CSSD, the Department of Children, Seniors and Social Development, the Department of Finance, the All-Party Committee on Basic Income that was established in 2021, all political parties, maybe employers with minimum wage positions, the federal government, and maybe others. What data is available to understand the problem? Has the issue remained fairly consistent, or has it gotten worse over time? Is this a problem that affects underrepresented groups more than others? Are there legislative concerns to address? Are there any acts or regulations that give legal authority for this? How will personal information be protected? Are other jurisdictions having a similar issue? Are there initiatives to increase income security in other provinces or other countries? What are they? Have they been successful? What challenges do they face? Is any of it relevant in our context? So once there's a comprehensive understanding of the problem, as a policy professional, you come up with solutions. So let's say you verified that the biggest barrier to improving poverty rates is inadequate basic income. So the maximum amount of income support that an individual or a family can receive from government does not exceed or even meet the poverty line. What are your options to increase basic income? And your cabinet paper is going to recommend a course of action, and it's also going to include other alternatives that have been considered. So in our example, we lead with the recommended course of action in our paper. So the Department of Community, and it is this, that the Department of Health and Community Services will replace income support for families with children, whether that's single parents or couples, with a guaranteed basic income. Now in our province, currently this represents about 20% of income support cases. Provincially, that's just over 5% of the population that receives income support. Another option, an alternative to that recommended option, is that the Department of Health and Community Services will replace income support for everyone on income support with a guaranteed basic income. Another option to consider is that the department will provide a guaranteed basic income for everyone living below the poverty line as reflected in the previous year's taxes. Another option yet is that the department would replace income support for everyone on income support and will increase the amount in line with inflation. And the last option, another option that would not be recommended, is that everything stays the same. And that's not recommended, of course, because nothing then will change. So there's a lot to think through. In order to generate solutions, we have to bring it back to the stakeholders. Talk to the public, current income support recipients, special interest groups, relevant government departments, etc. Need to think about who could be negatively impacted and how to address that. Who might be really helped? For example, will recipients be in positions to further their education or accept jobs? What about different age groups? Will they be affected differently? And how so? You always need to think about costs associated with the alternatives and the recommended option and justify spending on that recommendation. In our province, our government follows a zero-based process, which means that all expenses need to be justified for each new period. So under that zero-based budgeting approach, departments are building their budget requests from nothing, and they need to justify any continued investment in all areas of their operations. So then recommended options that fall outside of government's priority areas would be a very hard sell, which is not the case here. This does fall within government's priority area. Now, as you gain an understanding of the issue, and thought through the solutions, you engaged in consultations. That happens throughout the entire policy development process. You need to think about how much time, how much money and staff do you have to carry out consultations. So who needs to be consulted? In our example, the general public would be consulted. Current income support recipients, special interest groups, Newfoundland Labrador Housing, the CSSD, Finance, the All-Party Committee on Basic Income, all the political parties potentially, employers with minimum wage positions, the federal government, and others. These are the people who will help clarify the issue and the problem, and they're also going to help inform the recommended solution. So what are you going to talk about in your consultations? What are you trying to achieve through them? Are you trying to generate policy options or determine outcomes? When will you hold consultations? Think about if you'll do them at all of the steps in the policy process, or will you need to do more in the beginning as you're trying to understand the problem? Where will the consultations take place? Will they be face-to-face? Will some happen over the phone or online? Why do they need to be consulted? Are you trying to get information about the issue or get feedback on your proposed solutions? And then how will the consultations, What form will the consultations take place? Will you do them in person or virtually, or a combination? Will you invite members of the public to a kind of town hall meeting or hold smaller focus groups? Will you travel across the province for consultations? And how many will you do? Will you write a discussion paper for feedback from stakeholders? And I would say that cost considerations will likely determine how you consult with stakeholders. Now, consultation findings and your research can come together in a policy document. So we talked about when policy development or change requires cabinet approval. That example I just walked through that's going to require new spending. So that means change to current policy, and it would absolutely require cabinet approval to proceed. So your Minister of Health would seek cabinet support for the recommended option. And they'd have to show that all the feasible options have been examined. They'd have to show that the implications for implementation and any impacts on stakeholders, that's all been fully explored, and that all information that's vital to making an informed decision on the submission is presented. And when you think about the fact that a cabinet paper is a brief document, it's no more than 5 pages, that's not an easy task. Now, cabinet approves. So cabinet's going to approve the policy direction. Now it's time to implement. The policy is going to be implemented as a pilot in Newfoundland. So government's going to replace income support for families with children, and that may be single parents or couples, with a guaranteed basic income. They'll evaluate its effectiveness and then roll it out to others. That is, to anyone else who's receiving income support or anyone living at or below the poverty line in the province. So your job is to think through the implementation issues. Think about who's going to be responsible for what resources are required to implement, how you're going to get data to determine effectiveness, and then you implement. Once you implement, you want to determine if it worked. Now, this is another area where researchers may fit in. If a policy shop doesn't have expertise to evaluate, then they contract out that work. All families, are families or adults in the pilot reporting greater income security? Are they reporting enhanced well-being, better health? What data will you need to evaluate? Is any administrative data you need, is it readily available? Will you need to go out and collect your own data? And then how much time is that going to take? And what other resources is that going to take? You need to know what you want to measure and lay out a plan to do so, and know what resources the evaluation is going to require. And then this feeds back into the program to help improve it before it rolls out to the entire province. And that, in general, is how the cabinet process works. And all that happens within government to make and change policy through cabinet. Now, your research could initiate that process. It could inform a portion of it. It could also impact change without going through the cabinet process. That's possible as well. And during the policy cycle, there are a number of considerations that happen all the way through. And whether or not policy change based on your research would require cabinet approval, those considerations that I'm going to get to in a minute, those are all the same. So as you prepare policy documents to communicate your work to decision makers, keep these things in mind and incorporate them where you can. So let's look at policy documents from a researcher's perspective. You've done some high quality research and you want to communicate its potential impact on one of your government's priority areas. First of all, policy documents should be brief and to the point. So you're essentially saying, this is what we want, this is why you should give it, and this is how and when we're going to make it happen. So there are a number of considerations that need to be included, if at all feasible. And these are important things that policymakers are likely going to look for when they're reviewing proposals. So it's best to include it all up front to show that you've thought it through, if that's feasible. Now, they'll likely request some of this information upon reviewing any policy documents. So you want to give a statement that defines your issue. Like, what is the problem and what is the research proposal addressing? And what course of action are you recommending? So what are you recommending to address the issue? What are you asking of government, and who's going to do what? And you want to provide a brief background on the issue. You want to give some context, but not too much history. You want to focus mostly on the issue at hand. Why has the issue arisen? How is it currently being addressed? How does your recommendation or your proposal map on to current horizontal initiatives, current priorities, any departmental strategic plans or budget documents? Can you link it to anything in government's estimate document? Is there any other government initiatives that this could facilitate or complement? Can you tie what you're asking to a publicly made commitment? Does it support current government? Because if what you would like to do, if what you're proposing, or if you want uptake on is outside of current priorities, it's going to be a much harder sell. What is the current cost to the province? Give some pros and cons of proceeding with your recommendation. So you want to think through, think through other options or alternatives and explain why those might not work. Using evidence, you want to outline the impact of not doing what you're recommending to the people of your province, to the economy, etc. Looking at financial considerations, you want to think about what's the cost to the province to implement your recommendation? Where will the money come from? Is there money available anywhere else that could supplement, like any federal funding? Has there been an economic analysis that you can share? Are there any financial implications to other areas of government, like any other departments? Might there be savings as a result of the initiative? Can you quantify decreased costs in the long term? It is highly likely that any new funding request that's not in the fiscal forecast would be a much harder sell and would be closely scrutinized. Other situational impacts, things like thinking about service delivery. How will this happen? What types of human resources are necessary? What are the staffing requirements? Are there any safety considerations? And then what about legislative considerations? Are there any legal implications to implementing your recommended solution? Does what you're proposing require legislative change? Or what acts or regulations give legal authority for creating or changing a policy? For example, the health quality councils in other provinces, they have their own acts, their own pieces of legislation that give them the power to carry out their mandates, which include reporting on health system performance. A consultation with a lawyer could be beneficial to look at any legal or legislative implications. Has any consideration been given to how privacy concerns or how personal information will be protected? So for example, in Newfoundland and Labrador, personal health information is protected under the Personal Health Information Act and HIPAA. Will there be a need to amend any acts? And keep in mind that the Red Tape Reduction Initiative with our government is in effect trying to reduce burden on stakeholders by reducing red tape like counts in legislation. You want to think about other jurisdictions. So briefly describe any relevant experience and successes of other jurisdictions who've implemented something similar there. Do others have a similar issue that they're trying to solve? Are we leaders in this area? Are we lagging behind in this area? Do they have relevant legislation? And then what is the impact of your proposal on other departments? Have you consulted with them? What do they think? How will you address any concerns they might have? And what about any federal or provincial implications? Is there any federal support for what you're putting forward? Environmental considerations are important. Are there any impacts on the environment? So any kind of change involving like infrastructure changes, for example, like building construction, that could have environmental impacts. Does your initiative have any rural implications? Are these implications province-wide? What are the considerations for any underrepresented groups? So for example, does your initiative have gender implications? Is the impact the same for all genders and those who don't gender identify? Does your initiative have impacts on Indigenous groups? You want to describe any consultations that have occurred to reach a recommendation. So consultations with patients, with the public, any other departments at Memorial, for example, any other provinces, any professional associations, any other universities or organizations, and so on. What are the opinions of relevant stakeholders? Are there concerns? How will you address those concerns? And then think about communications. Who's your target audience? How will this be shared with the public? What will their concerns be? Are there any arising issues? Are there any political considerations? And how will they be addressed? There's a lot to think through. In addition to all of that, there are a few things to keep in mind when communicating your work to decision makers. So you'll want to be brief and clear about your purpose and the value of your work. And I mentioned earlier, you're essentially saying, this is what we want, this is why you should give it, and this is how and when we'll make it happen. And in doing so, you want to avoid a lot of technical language and just write plainly. You could include a short executive summary that's helpful, that captures the main points of your work. And infographics can sometimes be quite useful and impactful as well. So to clue up, thinking about if your research can lead to policy change, yes, it certainly can. And it should be high quality and relevant and accessible. It's really important, I think, to know that policy development is not linear. It's complex, and there's many things happening at the same time. There's many moving parts and people. But there is a formal process, and understanding that can help know where and when your research could be most useful and have the most impact. And the last thing I'll say is that everything I've just said in an emergency situation goes right out the window, and policies can change in an instant. And I think the lockdowns we experienced with COVID-19 are a perfect example of that. So that's all I'd like to share with you today. There are another couple of slides here, which will be shared, I think, on Newfoundland Support's website later, with some links to some relevant information and my contact information if anyone would like to get in touch. So I'll stop sharing.
That was excellent. Thank you so much, Cheryl. I always, having never done any policy research myself, I find it a little bit ambiguous. So every time you talk about it, I learn something new about it and I get a better understanding of how it works. So maybe one of these days I'll actually understand, but no, it's helpful.
I'll tell you, Chelsea, when I first started with government, I started within several months, within maybe 2 or 3 months, 4 policy analysts started within the same branch of the same department. And about 6 months in, someone came to me. She reached over my cubicle and she's like, Cheryl, so like, what is policy? So we were in it for 6 months and we still couldn't properly define it at that point. It takes some time.
Oh, can you hear me, Cheryl?
I can, yeah.
Okay, I'm going to keep my video off because I'm having some tech trouble here. But yeah, no, that's I think that about sums it up for sure. It's a very ambiguous topic because it's so it is so, can be so reactive, so reactionary, but also it can be something that, a policy can take years to create. So there's so many different angles to it. So we'll open it up for questions here now for Cheryl. So as I said, if you want to raise your hand, feel free to do so. I'm keeping an eye here on who's got their hand raised, and I can unmute you, or you can feel free to use the chat. And maybe while we're waiting, I thought of a couple questions while you were talking there, Cheryl. So I actually attended a session yesterday where somebody was talking a little bit about a unique situation that happened in New Brunswick where there was a failure of care for somebody that led to this big public outcry. And then basically because of that outcry, they developed this whole program, which included several policies around like injury prevention and that kind of thing. So I'm just wondering, in your experience, how are policies initiated? Like, what's the most common way for a new policy to come about? Is it based on those political priorities that you talked about, or is it because of that public outcry? Do you know what I mean?
I would say, I mean, a combination, I suppose. It will be, I can't say for sure, Chelsea, like what would hold more weight. I think that's what you're kind of asking a bit,
Sure,
like
yeah.
what can hold more weight, and I can't say for sure, but any and all of those things can impact. Um, but I think, I mean, political will is influenced by the public, so sometimes it can, I suspect, have more of an influence.
Yeah, that's a really good point, Cheryl. I see some questions here in the chat. Kathleen, do you want to unmute yourself and speak your question, or do you want me to say it?
Uh,
Oh,
she coming in? Hi, Kathleen.
no, okay. Well, I'll just speak it for her then. She says, I'm wondering if you have any suggestions on how best to include all of the background information and research that has been done to back up the policy recommendation, particularly where the cabinet paper needs to be kept so short. Are there supplementary documents that can be submitted?
Yeah, so Kathleen, you just answered your own question. Yes, that's how you do it, by including supplementary documents in I believe they're called annexes. So you can include all the information, but like additional evidence, yes, that and you should do that. But as best as you can, you want to include all the pertinent info in the body of that cabinet submission.
Okay, and Ashley says, does research need to be published before it can affect policy?
No, no, it doesn't. And there are ways to influence. There's ways to influence policy that's not necessarily government policy. So policy, say within hospitals, for example, the way they do things can be influenced without published work. So and that's kind of like evaluation type work, like evaluation cycles of quality improvement type things. But no, research doesn't need to be published in peer review. I think you're thinking about peer review type journals. No, or anywhere really to influence policy.
Thanks, Cheryl. Karen, I see that that you want to ask a question. I'm trying to unmute you here. It says that a request is sent. Are you getting that?
Thanks, Chelsea.
Okay.
Thank you, Cheryl. That was so helpful. And I was so relieved to hear when both yourself and Chelsea said that it is a bit ambiguous and it is a bit of a challenging thing to understand. I'm an assistant professor with the Faculty of Nursing, and it's something that has sort of always been beyond my understanding in terms of how to get research into policy and sort of the process. And I found the cycle and you giving examples and going through it so helpful. I can't tell you how helpful I found it. So I'm just wondering, I saw you had some websites there at the end, but I'm just wondering, because you said when you started, like you were sort of 6 months into it, and you're like, what even is, policy? Is there a book that you can recommend, or is there a website that you can recommend that it really like walks you through that process so that you can make sure that you're ticking all the boxes to get the work done?
Some of that will be in the links that I provided there. But a book, I'm sure there exists one. I don't know of it. I've never read it. Most of what I've learned has been experiential, really, and largely confined to here with our local context. But I'm sure that the process, well, I know that the process is similar elsewhere. There may be nuances to certain pieces of it, but the policy cycle in general, that's how it works. That's how they're made and changed. But because there are so many moving parts, and you know, there's a cycle, and there's consultations and considerations that are weaved throughout the entire thing. I don't know that there is you must do this, you must do this, like a step-by-step kind of approach to use for every possible solution, to every possible recommendation. There's going to be nuances between them depending on what you're doing, I think. But following that general cycle will help to communicate your work.
Okay, thanks so much.
Thanks, Karen. And yes, as I said in the chat, if Cheryl is okay with it, we will share her slide deck on the website. So those resources will be available to you. And maybe Cheryl's expertise as well, because she shared her contact information. So, you know, please feel free to reach out if you do have any questions as you get going on this kind of research. Okay, another question from Ashley here. If someone has just finished research, any tips for how to choose who in government to present it to? That's a great question.
Yeah, I mean, I'm assuming we're talking about health related research. So with our government, I would potentially reach out to a director of primary healthcare, if it's related with primary healthcare, to primary healthcare. So you want to find probably a director level within the branch of government or even the division that is relevant to the work that you're doing. So if I was doing something with primary healthcare or anything remotely related to that, I would go to their shop. Yeah. There's also another thing to think about is, are there any other groups doing anything similar or something that aligns with what you're doing? And to contact those groups within government as well, if you're aware of anything that's going on.
Yeah, that's a really good point, Cheryl. We have two other questions here about implementation. So Rashad said, what kind of challenges do you face during policy implementation, and how do you overcome them? And somewhat related, Kathleen asked about your example about moving forward with a pilot. And so is there a utility in suggesting a pilot as your recommendation in terms of that implementation piece?
Yeah, there's sometimes value in a pilot just because it would require fewer resources, like lower expenditures to see what kind of impact that the initiative could have. So there's value in that sometimes, largely for that reason. And what kinds of challenges do you face during implementation? All of them. There's often a lot of challenges. There can be a lot of challenges, and that's why consultations are so important with stakeholders, because they are the ones that will help you come up with ways to overcome them. They'll help you identify them and help you overcome them through those. That's why they're so important.
That's I mean, that's what we're always preaching with patient-oriented research, as well as the reason for doing patient-oriented research. So it's nice to see that that's something that's considered in the policy sphere.
Yeah.
I have another question. You kind of talked about it a little bit about influencing institutional policies, like on that smaller scale rather than governmental policies. Does the process ever work from the top up or from the bottom up? So where an institutional policy is influenced by a piece of research, and then it does really well in that institution, so it is applied to other similar institutions, and then eventually up to government policy change?
Yeah, it certainly can. What's coming to mind for me is kind of adjacent to what you're talking about. Like, we know in terms of models of healthcare and models of care, like things happen organically with providers in particular areas where they start working as teams, for example. A nurse practitioner, a family physician, a pharmacist, maybe a social worker, like there's no formal process in place, but they begin to work together because the needs of the local area require it, that they just begin working together organically, and that could trickle upwards into policy change around the model of primary healthcare that's delivered in the province, right? So
Yeah.
those sorts of things happen a fair bit.
That's nice to know, because I feel like that's especially in terms of NL support and the kind of project support we provide. If we ever recommend to somebody that they need to consider policy change, it is often at that institutional level in terms of health research projects, right? So it's nice to know that that it can work that way as well.
Yeah.
Okay, Varlene asked, do you have any tips for someone who wants to get started in policy research jobs?
Well, there's some, yes, it depends on where you're talking about. If you're talking about jobs within, say, in your government, well, I suppose anywhere, I would use policy related language in your letter when you're applying for a position, and I would target my experience with a policy, add a policy lens to your experience. Because really, like, what I came to realize in the absence of a definition of policy back when I was working in policy in the early days, what I came to realize very quickly is that a lot of you may have research backgrounds, like my education. Like, I have a master's in applied social psychology, which is a heavily research-based program, and touched on program evaluation as well. And what I realized, the work that I was doing, that's what I was doing in my policy role. It's really research and evaluation. So if that is your background, then I would talk about it with a policy lens and make it be seen for what it is, because it's directly related to policy work.
Those are great tips, Cheryl, especially, I mean, certainly you highlighted the necessity of research in the policy process. And now those consultations, that's a very evaluative approach to doing things. So all good things to highlight there.
And I would say, Darlene, if you want to contact me separately and have a chat, as if this is the area you want to go to, then we can do that.
Okay, are there any other, oh yeah, perfect. Are there any other questions? If not, I'm just going to share my screen very quickly to clue up with a few other housekeeping items. So I'll just let everyone know, as you know, I guess in the sense that you're here now, that we have a free training program. So our next session is later today about grant writing. So you're welcome to join me for that in half an hour if you like. But if not, the session after that will be on December 7th. And that will be about the public interest group on cancer research. Dr. Septep Savas is coming with a patient partner to talk about that excellent work. We will also be running a Foundations in Patient-Oriented Research program, which is a 5-week, quite intensive program about how to do patient-oriented research with the goal of learning from and about the other attendees in the program who might come from a variety of backgrounds, including researchers, policymakers, health professionals, patient partners, and the list goes on, whoever's interested in doing or being engaged in patient-oriented research. So we're planning on running that next in the winter, so keep your eyes open for that, and you can sign up for our newsletter to learn about those opportunities. And also our annual Science, Health, and Research Education Summit is coming up on November 10th. So it's an excellent spot to come learn about some of the work that we've been engaged in and the research that we've been supporting. So I encourage everyone to register to attend that. And you can attend virtually as well. And then, of course, you know, my door and telephone and email are always open. We're a support unit, and it's right there in our name. Please feel free to reach out if you have any questions or you want to follow up on anything that you heard here today or anything in general. And thank you, everyone, for joining us. I'll stop sharing there. And I've lost you. There we go. Back again. Good enough. So many windows open. Is there any last thoughts or questions before I let you all go? Thanks, Marsha. Thanks everyone for joining us, and thank you, Cheryl, for agreeing to do this session. And you know, you always put a new spin on it, and I really appreciate it.
Thanks, my pleasure. Reach out to anybody if you have any questions about any of this or any other policy related stuff. I'll do my best to help.
Excellent.
Thank you.
Have a good rest of your day.
You too.